Lupus is often called the silent thief of health, quietly attacking the body without obvious warning signs. Many people brush off fatigue, joint pain, or unusual rashes as stress or aging, but these could be subtle cries for help from your immune system. According to the Lupus Foundation of America, lupus affects over 1.5 million Americans, yet it often goes undiagnosed for years because its symptoms mimic so many other conditions. This delay can lead to serious complications, affecting vital organs like the heart, kidneys, and brain. Imagine feeling constantly tired, battling unexplained joint pain, or noticing strange skin changes, only to be told everything is normal. The frustration, confusion, and fear that follow can be overwhelming. Research has shown that early detection of lupus can significantly improve quality of life and prevent severe organ damage. But how can you recognize a condition that is so unpredictable and stealthy? The truth is, lupus doesn't always announce itself loudly. It whispers through subtle signs, tiny symptoms that are easy to overlook, but could be warning you of something far more serious. In this video, we'll uncover 12 silent but deadly signs of lupus that you must not ignore. These are the clues your body is sending, often hidden in plain sight, and recognizing them could make all the difference between early treatment and severe complications. Stay with us until the end, because some of these signs are so silent, most people don't even realize their body is trying to speak to them until it's almost too late. 1. Persistent fatigue that feels unstoppable. Have you ever woken up feeling like you didn't sleep at all, even after hours of rest? Fatigue is often the first whisper lupus uses to alert your body, and it's more than just being tired. People with lupus often experience overwhelming exhaustion that can make daily tasks feel impossible. According to a study published in Arthritis Care and Research, nearly 80% of lupus patients report persistent fatigue, which is often disproportionate to their activity level. Unlike ordinary tiredness, this fatigue doesn't improve with rest, and it can profoundly affect mental health, leading to anxiety or depression. Imagine missing out on life's moments because your own body feels like a constant weight. Many dismiss this as stress or aging, but persistent fatigue paired with other subtle signs could indicate lupus quietly attacking your immune system. The emotional toll is significant, making sufferers feel isolated and misunderstood. Recognizing this early can lead to interventions that improve energy levels and quality of life. If fatigue feels different, persistent, and overwhelming, don't ignore it. Your body may be trying to tell you something serious. Keep watching, because fatigue is just the tip of the iceberg, and the next signs may shock you with how quietly lupus strikes. 2. Unexplained joint pain and swelling. Ever felt joint pain that comes and goes, almost like your body is betraying you? Lupus often targets joints, causing pain, stiffness, or swelling without obvious injury. According to research in the Journal of Rheumatology, lupus-related arthritis affects more than 90% of patients, commonly involving hands, wrists, and knees. Unlike typical arthritis, this pain can shift from one joint to another, sometimes disappearing and reappearing mysteriously, making it hard to pinpoint or diagnose. The emotional impact is real. Performing daily tasks like typing, cooking, or even holding a cup of coffee can feel like a challenge. Patients often feel frustrated and helpless, struggling to explain the unpredictability of their pain to loved ones or doctors. Many people suffer silently, thinking it's just aging or overwork, when in reality, their immune system is attacking their own joints. Recognizing unusual joint pain, especially when accompanied by swelling or warmth, is crucial. Early treatment can reduce flare-ups, prevent permanent joint damage, and protect your overall quality of life. Don't scroll away. What seems like ordinary joint pain could be a silent warning, and the next signs are even sneakier than this. 3. Mysterious skin rashes, especially on the face. Have you ever noticed a red, butterfly-shaped rash across your cheeks and nose that appears without warning? This hallmark sign of lupus is called the malar rash, and it's often triggered or worsened by sun exposure. According to research from Dermatology Online Journal, around 50% of lupus patients develop skin rashes, ranging from subtle redness to scaly, inflamed patches. These rashes are more than just cosmetic. They indicate underlying immune system activity that could affect internal organs if ignored. Emotionally, sudden skin changes can be devastating, impacting self-esteem and causing anxiety about appearance. Many patients feel misunderstood when others dismiss these rashes as simple sunburn or allergies. This silent signal is your body's way of screaming for attention, often long before other severe symptoms appear. It's important to monitor your skin closely and report unusual rashes to your doctor. Early recognition can lead to interventions that prevent complications and reduce flare-ups, improving both physical and emotional well-being. But don't think the warning stops here. Some of the most dangerous lupus signs are hidden deep inside your body, waiting to be discovered. 4. Unexplained fever and night sweats. Have you ever experienced a fever with no cold or infection? For lupus sufferers, low-grade fevers and night sweats can occur as the immune system becomes hyperactive, attacking the body itself. Research published in Lupus Science and Medicine shows that recurrent, unexplained fevers are present in many lupus patients and often appear before more obvious symptoms, making them easy to overlook. This symptom can be frightening. Your body feels unwell, yet doctors may not find an infection. The uncertainty can cause stress, anxiety, and even self-doubt, leaving sufferers questioning their own perception of health. These fevers are subtle yet dangerous clues that the body is in an inflammatory state, signaling the need for careful evaluation. Tracking unexplained fevers, especially when combined with other subtle signs like fatigue or joint pain, can be a lifesaver. Early detection means doctors can start treatments to control inflammation and prevent organ damage, helping patients regain stability in life. And if you think these signs are random, the next ones will reveal just how stealthy lupus can be. Don't miss them. 5. Hair loss that comes out of nowhere. Have you noticed more hair in your brush than usual, or patches thinning unexpectedly? Hair loss, or alopecia, is a silent warning that lupus might be affecting your body. Studies in Lupus Journal indicate that up to 50% of lupus patients experience hair thinning or shedding at some point, often during disease flare-ups. Unlike regular hair loss, this can happen suddenly, in clumps, or appear as fragile, breaking strands. The emotional toll is profound. Hair is closely tied to self-image and confidence, and losing it without explanation can leave someone feeling anxious, self-conscious, or even depressed. For many, it's a visible reminder of an invisible disease that silently disrupts their health. While hair loss alone doesn't confirm lupus, when it occurs alongside other subtle signs like fatigue, rashes, or joint pain, it can serve as a critical clue. Early medical evaluation can help manage disease activity and even allow hair to regrow, improving both health and emotional well-being. And hair loss isn't just cosmetic. What your body hides beneath the surface could shock you when you see the next signs. 6. Chest pain or shortness of breath. Have you ever felt a tightness in your chest or struggled to catch your breath for no apparent reason? Lupus can silently inflame your heart, lungs, or blood vessels, causing symptoms that many dismiss as stress or anxiety. Research from arthritis, research and therapy shows that lupus increases the risk of cardiovascular complications, with inflammation of the heart lining, pericarditis, or lungs, pleuritis, appearing in a significant portion of patients. The experience is frightening. Sudden chest pain or breathlessness triggers fear, yet testing may initially show nothing obvious. This unpredictability adds emotional strain, leaving sufferers questioning their own body's signals. Recognizing these subtle cardiovascular signs early is crucial. Consulting a doctor when chest discomfort, palpitations, or shortness of breath occurs, even intermittently, can prevent serious complications and safeguard your life. Managing lupus proactively protects both your body and peace of mind. Don't ignore these warnings. What's coming next could be even more subtle but potentially dangerous if left unnoticed. 7. Mouth or nose ulcers that won't heal. Have you ever noticed small sores inside your mouth or nose that appear out of nowhere and just won't heal? Recurrent ulcers are one of lupus's quietest signals, often dismissed as stress or minor irritation. Studies published in Lupus Science and Medicine suggest that around 40% of lupus patients experience these painless yet persistent lesions, sometimes appearing before more visible symptoms. Though small, these ulcers indicate that your immune system is overactive, attacking healthy tissues. Emotionally, they can be draining. Constant discomfort affects eating, speaking, and daily confidence, leaving individuals frustrated and self-conscious. Paying attention to repeated or unexplained sores is vital. While they may seem minor, in combination with other silent symptoms like fatigue or joint pain, they could provide an early clue to lupus. Early evaluation and treatment can control flares and reduce discomfort, ultimately protecting overall health. These tiny ulcers might seem harmless, but the next signs show just how deep lupus can quietly affect your body. 8. Swelling in legs, ankles, or around eyes. Have you noticed puffiness around your eyes or swelling in your legs and ankles for no apparent reason? This could signal kidney involvement, a serious complication of lupus known as lupus nephritis. Research from the American Journal of Kidney Diseases shows that up to 60% of lupus patients experience kidney issues at some point, sometimes without obvious symptoms beyond subtle swelling. The emotional impact is heavy. Sudden swelling can cause worry and fear, especially when doctors find no infection or injury. Many patients feel anxious about their health, unsure whether something serious is brewing internally. Monitoring for unexplained swelling is crucial, especially if it comes with fatigue, high blood pressure, or foamy urine. Early detection allows for timely treatment, preventing long-term kidney damage and protecting overall well-being. Recognizing this silent signal could literally save your life. Swelling is just the beginning. The next signs reveal lupus's ability to sneak into your body in ways you may never expect. 9. Sensitivity to sunlight. Photosensitivity. Have you ever noticed a sudden flare-up of rashes or joint pain after being in the sun? For many lupus patients, even brief sun exposure can trigger symptoms. According to research in Lupus Science and Medicine, photosensitivity affects nearly 70% of lupus sufferers, making sunlight a hidden trigger for skin rashes, fatigue, or joint inflammation. The emotional impact can be significant. Imagine having to avoid sunny outdoor activities, vacations, or simple walks just to protect your health. It can lead to feelings of isolation, frustration, and even anxiety, especially when friends or family don't understand the seriousness of your condition. Recognizing your body's sensitivity to sunlight is a vital clue. Wearing protective clothing, using high SPF sunscreen, and tracking flare-ups after sun exposure can help manage symptoms and alert your doctor to potential lupus activity. Early precautions can significantly reduce skin damage and prevent more severe flares. Sunlight seems harmless, but for lupus sufferers, it can be dangerous. And the next signs reveal how quietly this disease can affect your organs. 10. Cognitive problems. Lupus fog. Do you find yourself forgetting things, struggling to focus, or feeling mentally foggy for no reason? This is a lesser-known but common lupus symptom called cognitive dysfunction, or lupus fog. According to arthritis and rheumatology, up to 50% of lupus patients report difficulty concentrating, memory lapses, or confusion. The emotional toll is heavy. Imagine trying to work, study, or manage daily life while your mind feels sluggish and unreliable. This invisible symptom can make sufferers feel frustrated, embarrassed, or even isolated. Many mistake it for stress or aging, but for someone with lupus, it's a direct consequence of inflammation affecting the brain. Being aware of these cognitive changes is essential. Discussing them with your doctor can lead to treatments or strategies to improve brain function and reduce flare-ups. Recognizing lupus fog early allows patients to regain control over their mental clarity and overall quality of life. Lupus affects more than your body. It can sneak into your mind too. And the next signs? They reveal how serious this disease can get if left unnoticed. 11. Swollen lymph nodes. Have you noticed lumps or swelling in your neck, underarms, or groin that appear without infection? Enlarged lymph nodes can be a subtle indicator that your immune system is in overdrive, as happens in lupus. Research in clinical rheumatology highlights that lupus patients may experience lymphadenopathy, often alongside fatigue or fever, signaling immune activity against the body itself. Emotionally, discovering swollen lymph nodes can be alarming. Many people fear cancer or infections, and uncertainty can cause anxiety and stress. This silent symptom is a warning sign that the immune system is hyperactive even when no other symptoms are obvious. Monitoring for persistent swelling and reporting it to your doctor can lead to early diagnosis, prompt treatment, and better management of lupus. Early attention ensures that complications are minimized, helping patients maintain both physical health and emotional well-being. Lymph node swelling might seem minor, but lupus often hides deeper threats. What comes next is the most dangerous of all silent signs. 12. Unexplained chest or abdominal pain. Finally, persistent or recurring pain in the chest or abdomen without a clear cause could signal lupus attacking internal organs like the heart, lungs, or digestive system. Research in the New England Journal of Medicine shows that organ involvement is common in lupus and often begins subtly, making it easy to overlook. The emotional impact is profound. Experiencing unexplained pain can be frightening, leaving sufferers anxious and worried about serious health problems. Ignoring these signals can have dangerous consequences, as delayed detection increases the risk of organ damage. Paying attention to unusual recurring pain is crucial. Combined with other silent symptoms, it could be a vital clue for early lupus diagnosis and treatment. Addressing organ involvement promptly can protect your life and prevent severe complications. Don't ignore these silent warnings. Your body might be trying to tell you something urgent, and recognizing it early can be life-saving. Here's a warm, motivational, and emotionally engaging conclusion for your video, crafted to resonate deeply with your audience and end with a call to action. Conclusion. Living with an invisible condition like lupus can feel overwhelming, confusing, and even isolating. Many of the signs we discussed, fatigue, joint pain, mysterious rashes, cognitive struggles, or organ-related issues, often whisper quietly, making it easy to ignore them until they grow louder. But the truth is, listening to your body and recognizing these subtle signals is one of the most powerful steps you can take to protect your health and your future. Every symptom you notice, every change you acknowledge, is your body's way of reaching out for care and attention. Remember, you are not alone in this journey. Millions of people face similar struggles silently, and small, proactive steps, like monitoring your symptoms, consulting healthcare professionals, and educating yourself, can make a life-changing difference. Early detection and timely intervention can prevent complications, reduce flare-ups, and help you reclaim your energy, confidence, and peace of mind. Your health matters, and taking these silent signs seriously shows the strength and care you have for yourself. By staying informed, attentive, and proactive, you empower yourself to live life fully despite lupus's challenges. Your body is speaking. Listen closely, take action, and don't underestimate the power of early awareness. If you found this video helpful, don't forget to like, share, and subscribe to our channel. Hit the notification bell so you never miss life-saving health insights. Together, we can raise awareness, support each other, and navigate the challenges of lupus with courage and hope.